And I'd like to thank the conference organizers for allowing us at Mayo Clinic to be a part of this wonderful conference with you all over the next few days. I'm delighted to be here with all of you today because I think of this as an extremely exciting conference that's bringing together stakeholders and thought leaders across all of Asia in medicine, industry, research, and in so many fields, with all of us together focused on one very important goal. That is fighting disease, bringing healing and hope and health to our patients. It also reimagining cures that have been elusive to medical science for generations, and really thinking carefully about the process of successfully, expediently, but sustainably embracing change, as we just heard about from Her Excellency, the Ministry of Health, so that together we can transform healthcare. The founder of the Mayo Clinic, Dr. William Worrell Mayo, was actually born in England in 1819. And in 1846, he immigrated to the United States. And it is his international outlook, as well as his dedication to excellence, that really shaped the Mayo Clinic. He had two sons, Dr. Will and Charlie Mayo, both of whom went on to become physicians and make a global impact in healthcare. And every year during their long careers, they would spend at least several weeks every single year traveling internationally to learn from others, to meet with scientists, educators, world leaders, to share what they had learned at Mayo and bring it to others as well, so that they can serve the patient better and advance healthcare. Mayo Clinic became a very special place because of a unique juxtaposition of the rigor of the Mayo brothers, their scientific rigor, as well as their dedication to innovation and education, combined with the compassion of the Sisters of St. Francis, who dedicated themselves to serving by working in the first hospital at Mayo Clinic. And it remains this unique characteristic of scientific innovation, education, combined with deep compassion that really is the core of what we consider ourselves at Mayo Clinic even today. At Mayo Clinic, where we are based out of Rochester, Minnesota in the United States, we are humbled to be the world's first and largest integrated group medical practice that's focused on serious and complex disease. And over the last 150 years, we have served millions of patients from all over the United States and 130 countries, from our 8,000 physicians and scientists, our over 5,000 research staff. Until today, our primary value has and always will remain that the needs of the patient come first. And we saw in the first few years of the pandemic, all of us together, that the very, very fast-paced implementation of laboratory-based science really changed the health of all of our nations. In fact, it changed the economies of all of our nations. And what that tells me is that the future of healthcare is truly only limited by the boundaries that we are going to set. It's only limited by our ability to dream. And it really is the responsibility of every one of us who is sitting in this room today and who will be participating in this conference to transform and create the future of healthcare together. Today, we're living at truly an unprecedented time. If you were to go to some of our colleagues 100 years ago who were practicing medicine and science and talk to them about doing an MRI or robotic surgery or gene therapy, they would have never believed it. And even think about communications. The first cell phone was invented about 50 years ago. And by the late 1990s, we could send an email from a pager, which was quite exciting at the time. And just think now how we can, on our phones, do a video chat with someone on the other side of the world and never even think about that being a big deal. It's stories like that that make me think about our founder, Dr. Will Mayo, who in 1931 said, "I look through a half-open door into the future, full of interest and intrigue beyond my power to describe." It really is amazing how far we have come since that time and how marvelously we have changed healthcare until now. But it also is telling us how we have to continue to reimagine and challenge boundaries, not just in terms of finding new discoveries or doing new research or new ways to deliver care, but really thinking about healthcare at its core. And what I'm going to talk to you about today is how we have to together transform healthcare through platforms. That is really how we at Mayo Clinic see the future of healthcare. That we have to relearn how we've ever approached and taken care of patients into platform thinkers, away from the traditional pipeline model, which was in silos. So we would all practice medicine in different hospitals in different places around the world. We have to now transform that to a platform model that's absolutely essentially defined by partnerships. About 4 years ago, before the pandemic began, Mayo Clinic decided to think about what is it that is going to be able to address the systemic issues in healthcare globally. How are we going to be able to embrace the new technology and the way everything is happening on platform models and other areas and make it relevant to healthcare so that we can address some of the issues that we have? And how can we do that, not just at the Mayo Clinic in Rochester, Minnesota, but how can we do that in a way that's going to touch patients and touch healthcare all over the world? And then, of course, the pandemic happened, which slowed many things, but also because of the pandemic, actually accelerated much of what I'm going to talk to you about today. We know that in order to make this future reality, we had to start by transforming ourselves first. So at Mayo Clinic, we launched a plan to transform healthcare through 3 interconnected objectives: to discover more cures for complex and serious conditions, to connect people and data to create new knowledge, and to transform our entire healthcare system from a pipeline model of delivery to a platform model. And we also knew that we could not do this alone, that we would have to work together with our peers, with businesses, with startups, with governments, and that together we would have to innovate and create this in a way that we can make it relevant as a blueprint for others to follow. So as we look at the future of healthcare, and for the purpose of this talk, I'm going to focus on 3 key elements. Firstly, the platform architecture. Secondly, artificial intelligence and digital health. And thirdly, individualized medicine and population health. So our goals in transforming involve innovating in ways that will make healthcare more integrated, more equitable, and more efficient through what we created and call the Mayo Clinic platform. Right now at Mayo, this has brought together troves of data. We have 30 million de-identified longitudinal patient records that are part of our distributed network. And we're using this with artificial intelligence and machine learning to provide new insights into diseases and new ways of managing care. Right now, 30% of the top hospitals, as reported by Newsweek, are part of the Mayo Clinic platform. And that's a good thing for everybody, because what it does is it democratizes and makes a radical new vision on how we can share data and form a more innovative, dynamic, and scalable approach. It allows Mayo Clinic and external collaborators to use this massive, secure, de-identified patient sets to work together and remove those silos from one hospital in one country to another hospital in US versus another hospital in Malaysia. We're all sharing the data together. We're all trying to solve difficult problems in the way healthcare is delivered or in diseases. So this may sound very theoretical, but let me give you some very real examples that are happening right now. Since this has started, we've already found ways to denoise CT scans, to auto-contour radiation therapy profiles for patients, to detect pancreatic cancer early, and there are many, many more on the list that we could go through. At the same time, this data is being run automatically every day. Every new patient that comes, it feeds into it, and every new time we do our algorithms or we try our machine learning, we could be solving problems today that we weren't able to solve yesterday because it's continuously feeding into each other. And we know we have to use this in a way that has space for everyone, for medical centers, for biopharm, for biotech, for device manufacturers, for startups, for NGOs, for governments, for collaborators, and most importantly, for our patients. And the beauty of the platform model is that when we discover these algorithms, it doesn't just stay at Mayo Clinic. It can go anywhere in the world for all of our partners who are sharing in this de-identified federated data source. And let me give you an example of one that's recently happened. Investigators at Mayo have found an AI tool from this data that can take a routine 12-lead ECG, and it can apply it with a simple click in the electronic medical record, and it can predict who is going to get heart disease years ahead of what they would have otherwise done. And you can take that even a step further, and you could do it from a single lead EKG off your smartwatch that can actually look and predict who's going to get heart disease years before the person. And so what that's allowed us to do is we're now doing a clinical trial amongst women who are just postpartum in Nigeria to look for postpartum cardiomyopathy. Now, this is a population that we could have never touched otherwise. We could have, it's very, very hard to detect in this postpartum population. And it's a group of women who probably would not have had access to health care, much less this sophisticated health care otherwise. This is democratizing health care. This is bringing access, affordable, easy ways to touch people all over the world through this platform model. But to do this, we have to create end-to-end solutions. Otherwise, it's a dead end. And what I mean by that is we have to have a way that's part of the normal provider workflow, and it's very easy, and it gets back to the provider and works in a way that it can help the patient and have an impact. It's got to make it that last mile. It's got to make it all the way to Nigeria. And that is how we look at transforming healthcare on a much larger magnitude. In fact, we anticipate that in 2023, the Mayo Clinic platform will positively impact 20 million lives. That's 14 times more than the number of patients we can touch each day in person through our clinics and our hospitals. And we're also focused very much on what is called the algorithmically underserved population, to make sure we're getting diversified data that doesn't have bias in its design, in its algorithm, and in its development, and make sure that we're labeling, modeling, assessing populations with accurate validation. While artificial intelligence algorithms have been part of what we use every day, from how we choose movies, how we book airlines, and many other industries, it's been very slow to enter healthcare. And that's true in many ways. Healthcare is both deeply emotional as well as scientifically rigorous, and we tend to be very cautious and adapt technology rather slowly. But right now, we're at a critical juncture. We have a confluence of expertise, data, and opportunity where we have to start applying these platform models and these ways of applying algorithms to that model to serve and to power a better future. And this is not what we're talking about in healthcare for 5 years from now. It's not even what we're planning for 10 years from now. This is happening right now, and it's up to all of us to make this a reality for our patients. So many of the world's leading healthcare institutions, including Mayo Clinic, are using AI for diagnostic capabilities, for detecting symptoms earlier, for enhancing clinical decision-making, for automating rote tasks to minimize the administrative burden on our providers. And we know that this is feasible, and we know that AI is inherently scalable. But we have to take it further, and we have to drive it in a way that it is going to transform the very way that we see our patients. Now, we can't look at AI as a panacea to solve every large structural problem in the healthcare system. But we do need to look at how we have to transform the rest of the healthcare system to meet this new model. We're going to need different physical space that integrates with digital space in order to give care. We're going to need a future of healthcare, and I'm going to give you an example where an AI-powered smart device registers to somebody that they have an abnormal heartbeat. And then an AI-based systematic app seamlessly triages that patient to a cardiologist that happens to be in their city, in their country, somewhere in the world, and they're able to get an appointment quickly. And then that provider has an AI-assisted health record that then helps them decide what is the best treatment for this patient. And then just as importantly, that data goes back into the platform for researchers to use to continue to find new treatments and new ways to take care of the patients. And once again, this is where we are right now, and this is what we have to make as a reality for all patients everywhere. At Mayo Clinic, we have physicians who have developed a predictive model that they can identify the top 1% of older patients who are most likely going to need to come to the emergency department or the hospital in the next 6 months. So of your 100% of patients out there, they know that 1% that are high risk of coming in. It's called the Elder Risk Assessment. And this report is run every single day and allows the providers to then do preemptive intervention, for those patients to find ways to help prevent them from needing to come to the emergency department or the hospital. And we know that that population doesn't do well in our old-fashioned clinics where you have consulting rooms and our old-fashioned hospitals. So it has different ways of bringing home health to them, of virtual care, of care coordination, of community paramedics, of palliative care, and even hospital in the home. So throughout healthcare, we're seeing a transformation not only in how we fundamentally approach and treat disease, but we're moving that treatment of disease from the symptomatic level to the molecular level. And so what I mean by that is we're not just looking at every patient and every disease the same, but we're able to be very, very specific and targeted individualized medicine. One of these tools is called spatial transcriptomics, which combines the study of genomic expression with spatial orientation and allows physicians and researchers to examine a tissue not just at the molecular level, but also at the cellular level, not just in time, but in space. And what I mean by that is you can actually target where you are in the tissue. One way that may make sense to you or the relevance is through a disease like polycystic kidney disease or polycystic liver disease. Previously, if you had to look at the genomic material, you would take the whole tissue, you'd degrade it, you'd sequence the DNA, you'd look for mutations, and you wouldn't know whether that's coming from the cyst or from the normal tissue. Through spatial transcriptomics, you can specifically target exactly where you are in the tissue, do the genomic testing, and you can imagine the relevance that would have on treatment, that you can specifically deliver the appropriate treatment, the appropriate drugs, to the part of the tissue that's needed, and do this for individualized cancers. By studying and assessing these microenvironments, it allows us to use new therapies we could not have imagined before. Many of these are immunotherapies you've heard of. CAR T cells, even more advanced than CAR T cells, or the BiTEs, which are going to be taking over, immunotherapies, neoantigen vaccines, cell therapy, gene therapy, all sorts of different ways that we can start to very, very specifically treat human disease. So what does this transform health system look like? It is very different than what we have today. Right now, our system is very reactive, it's impersonal, and in many times it's inconvenient. Transformation will bring a preemptive, individualized, personalized, and accessible care that can get to the patient anywhere. What if we can identify disease in a patient years before it happened? And then let's take that a step further. What if we can identify disease in an entire population before it happens, find the at-risk population, and do an intervention that could mitigate that risk? To do this, we truly believe at Mayo Clinic we need to build these unique platform architectures to specifically emphasize and address the healthcare issues in order to answer these questions. There must be data privacy, but we also have to have broad collaborations. We need to be able to diagnose serious heart disease before it happens so that we can intervene. We need to be able to identify who's most at risk of having a complication from surgery so we can have early intervention. We need to be able to diagnose from imaging alone, so you don't need to have to do surgeries and biopsies and other intervention. And we need to be able to deliver care, hospital-level care at home. In order for transformation to be transformational, it must address equity and inclusion. And one way we're doing this is by increasing access to clinical trials, by finding ways to bring our clinical trials to our patients through our distributed networks, to be able to do the clinical trials in Nigeria, to do them in Kuala Lumpur, to do them anywhere in the world, so that everybody has access to the newest data and to the newest discoveries and cures that are available. As AI tools and digital health advance, I'm certain we'll have more capabilities to address some of these issues at an individual level as well as at a population level. And absolutely, it's going to take a village to do all of this. It is going to need all of us, doctors, scientists, biopharm, biotech, governments, startups. It is going to need all of society to look at how we can use these tools to address healthcare and transform the way we take care of our patients, the way we build our buildings, the way we address disease, and the way we cure uncurable diseases from before. I'm so glad this conference has convened clinicians and researchers, as well as industry and thought leaders across so many disciplines, because we are going to need a multifaceted platform to discuss and share ideas and solutions. There's never been a greater need for transformation of healthcare than there is right now. And as hard as these past 3 years of the pandemic have been, and because of it, I believe as a healthcare community, we've never been in a better place to embrace change and drive this transformation forward. By embracing platform thinking, specifically for AI and large language models, and personalizing care, we have and will continue to see greater innovations and discovery that results in more cures and new approaches to high quality, accessible, equitable, and affordable care for patients everywhere in the world. This is our vision for the future of healthcare, and I've never been more excited about it than we are now. And I embrace all of you joining this vision with us as we make a difference for every patient everywhere. Thank you.